My friends, this is an amazing day for us here in BC. NDP have now stopped the pharmacies from giving out take-home supply of medication, oxys, dillies. These dillies were just basically getting given out in handfuls. Some people getting, like, watch my videos, people were getting 24 up to 24 2 milligram dillies a day. Some were getting 8 milligrams, up to about 34 milligrams a day. People were getting, I watched it, I saw them, I went with them from the streets into the pharmacies, watched them get it. It was unbelievable. I filmed so much of it, it's unreal. And I've been waiting for this day to come when they're going to stop this, because it doesn't help the addict. The addict needs support. The addict needs therapy. The addict needs help. The addict doesn't need more dope. Period. I'm not going to try to get someone sober by giving them a six-pack and put it in their fridge once a week. Just doesn't work. It's not going to help them. It's not going to help them. It's not going to help them. So please understand here, it was the new Democrat administration that crafted the unwitnessed safe supply policy during COVID-19, downplayed any suggestion diversion of government drugs was happening, ridiculed critics as fearmongers, stifled police, gaslit the public, and shamed anyone who stepped forward with contrary information. And finally, after a leaked internal document this month confirmed the program was fueling organized crime. Listen, the reality was just this. They created this program during COVID when nobody was allowed to say anything. They shut everything down. You weren't allowed to talk about anything. If you did, you lost your job. I didn't. I left my work. I left my work, and then I bought cameras and started doing videos and started interviewing people and finding out what the real problems were. The biggest problem was, yes, that they started giving safe supply out. Now, there's people out there that they swear that this is the right thing to do. These are people that have watched, someone detox from heroin. It's ugly. Trust me, it's not nice laying on your floor in your bathroom, sweating on the cold, hard pavement, and it's the only thing that feels good because it's so sore. It's a brutal situation. So they came along with the safe supply. Oh, well, we'll just give them something else, and then we'll give some counseling to them. We'll give them some help. Well, what they did is they gave them the drugs, but they didn't give them anything else, which is the government's been lacking in giving any help. They've just been giving drugs. So this confirms it. The Coast Reporter, it's like, I can bring up 100 different news documents about this. It's ludicrous, and it's now stopped. And just to inform you, if you have a prescription and you have a spinal cord injury, you lost your leg because of, it was pretty scary last night because they released this information and they basically didn't talk about the reality. Does this mean that if you have a prescription? I talked to a bunch of people last night. They're all freaking out. What does this mean? What does this mean? Nobody told nobody. Don't cause stress when you don't have to cause stress, government. NDP. All right, friends. So this is Dr. Paxton Bach. So this was filmed over 2 years ago, and we're going to get into this. I want to go through this with you. It's 6 minutes long. God bless.
My name is Paxton Bach. I'm an addiction medicine specialist at St. Paul's Hospital, and I was asked to speak today about what it's like to be an addiction medicine physician in the current era. Working in the context of an evolving, toxic, unpredictable drug supply was never anything that we trained for, and is certainly not what our system was built to accommodate. Our work has become incredibly challenging, more and more complex, and all too often full of a combination of grief and outrage that I can't put words to.
These guys, it's got to be the most stressfulest job, but going through it as a addict, you're blinded. But these people aren't blinded. They see it. I don't know how they can go through it and not be, the doctors can't be the advocates for the change that needs to be done.
As an addiction medicine physician, I witness how this unpredictable drug supply, how this ever-changing drug supply is putting people's lives in danger on a daily basis. Whether using for the first time or whether somebody has 20 years of experience, everyone is at risk. It has also made providing addiction treatment, which is already complicated in an incredibly siloed system, that much more challenging.
A siloed system, so that just means a system that doesn't have or give a shit about treatment or people like that. You don't see nothing except for that, and there's no color. It's just that. Sounds very autistic without feeling.
Every day, myself and my colleagues see patients in our offices or in hospital who are telling us about their experiences navigating this toxic drug supply. Many of those stories aren't reflected here today. I hear of blackouts, of assaults, seizures, infections, non-fatal overdoses, and so many more consequences that we're not seeing in this report today.
Yep.
Some of those patients are coming to see me seeking treatment, seeking help with their use. And
I get about 50 emails from people that want help. I have nowhere idea to send them. I've got a few places that they can go to up in the Okanagan, but it's a 2 or 3 week wait list, and unless you have a place for them to go today, they might not be here tomorrow, or in 2 weeks they just don't want to go.
I do have medications that are still helpful, and yet they're more challenging to treat than ever before, and our system is buckling under the burden of patients that we're trying to serve.
You do not have medication that will serve them or help them. I'm sorry, unless you're going to give them some Valium to calm them down.
Some of those patients are coming to see me not for treatment, but simply to try and access a supply of drugs that won't kill them. And for those who make it,
I went there. They wouldn't give me my medication when my doctor was dying of cancer. They said, too bad. And I said, what, am I going to go to the street? They're like, you have to find a doctor. We're like, we can't help you here.
in front of me who come to see a prescriber and who've navigated that system, I'm
sick.
already confronted with the reality that our
what?
healthcare system is already under an enormous amount of strain and cannot take on this further burden. And that in having them come to see me in order to access that drug supply, we're
Check.
already missing out on those who are most vulnerable at overdose and those who cannot access the medical system to begin with.
It's a big mess of mess.
In both of these encounters, we're starting from a place where neither I nor the individual themselves actually can reliably tell me what drugs they've even been using. This leaves us guessing from the start and is an incredibly uncomfortable and often dangerous place to begin.
I got video of people like picking up rocks off the ground and then putting it in a pipe and then lighting it, and you're like looking at them and you're going, bro, that's not like, that's those are rocks. No, those are rocks, bro. Leave me alone. I just want to say, giving out more drugs to like solve the problem did not help. It shouldn't have helped. They should have never done it. They started this like 15 fucking years ago, and it's a mess. Oh, George, sorry, just blew the corko.
I look at the figures that are being presented today, and in them I see reflected the stories of my patients, the human stories of the people that we're seeing on a daily basis.
God bless boys.
There's no industry. There's no socioeconomic class. There's no region of our province that is not being touched by this crisis.
Last summer, I drove all across the whole province in a motorhome. I saw it at every town, every single town. I was in Hickson, and there was a dude like that was just wrecked with a big pea stain, walking across the highway.
And for every one of these deaths we see here today, there are 10 more individuals who are experiencing non-fatal overdoses, infections, or many other consequences due to the toxic drug supply that we're not seeing here today. Not to mention the trauma, the incredible trauma that these deaths are inflicting on communities who've lost family members, often multiple family members and friends, to toxic drug deaths.
Did anybody watch the video from yesterday with our MLA from Skeena from up in Prince Rupert? She's lost her sister, her cousin, her nephew, her 10-year-old nephew. Like,
this has gone on far too long.
this is 2 years ago.
And it demands an urgent response that's commensurate
This was filmed 2 years ago.
with the scale of damage that we're seeing. And one that's reflective of the response that our citizens, our family members, our friends, and our communities deserve from the beginning. I often hear a narrative of investment in harm reduction versus treatment. And I would say I want to push back on that narrative, because once we start down that pathway, we've already lost. Yep. The reality is that we don't need to invest in any one strategy, but a spectrum of care that our patients are desperately deserving and needing.
100%, brother.
And we need to recognize that an individual's relationship with substances and their journey is seldom a linear one. I have patients who are engaging with me and trying to stabilize on medications, but continue to lean on harm reduction services to stay alive in the meantime.
Yep.
I have other patients who have been in treatment or recovery for weeks, months, or even years. And yet, setbacks occur. And it's very important that they have those safety nets to fall back on and to ensure that those setbacks aren't fatal.
Mm-hmm. God bless you, brother.
To the families that have lost individuals, to the 45 family members, to the families of the 45 individuals who have passed away in the last week alone from a toxic drug supply.
1 week, 2 years.
To their friends and their colleagues and their communities and their loved ones, my heart goes out to you, and I'm so sorry that we're continuing to fail.
Wow.
I hope that we can sit with that grief and that outrage. I hope that every member, every citizen of the province reflects on this report and feels that outrage and uses that to drive the advocacy that is needed to generate change. Everything from access to a regulated and predictable and non-toxic drug supply to an effective, accessible, flexible, patient-centered treatment system to investment in upstream drivers of substance use and prevention.
So this is person-centered shit they're talking about. Person-centered. So person-centered is a term that CLBC created when they had adults that were aging out of the ministry and going into adult care for CLBC, and it was the social workers that moved the kids up into adult care. They would figure out how to, I was part of this whole thing when it happened. So I had kids age out and stay with me in my home. So we would have to do these studies and research. So some person that went to school created this document, and this document that says, well, what does the child want? What does the person want? And let's involve them in how they can have their life supported and best be put at. And then we'll drive that. So they wrote up this document about how to ask the questions to the person that's got a 68 IQ. Like, this person's got a 68 IQ, and they're being involved in their help, their life. You know, I watched one of my kids. I helped put him in basketball. The kid never played basketball before, and then he had an addiction with Justin Bieber, and he ended up playing for Team Canada. And he went down to LA, and he got to meet like Justin. It was an unbelievable experience. They do this person-centered thing, and it's all around this. Like, what does the person want? You can't ask a homeless crackerjack or down person what they think's best for them. Fuck, you couldn't ask me 4 years ago. They had me on so much, I was ripped out of my head. I mean, I wasn't ripped out of my head. I was working, I was managing, I had 2 children, I had a dog, I had an ex-wife, I had a new son that I was adopted that had some mother that had mental health problems. It was fucked. It was hard. I can't believe I got through it. Like, I can't believe this guy got through it. This is 2 years ago. 2 years ago. And this is him today.
Going forward, people prescribed alternatives to toxic drugs will no longer be able to take them home or use them without supervision. With more on this, we are joined by Dr. Paxton Bach, co-medical director with the BC Centre on Substance Use and an addiction medicine physician at St. Paul's Hospital. Thank you for joining us today.
My pleasure.
First off, I think this came as a bit of a surprise to a lot of people. What was your reaction when you heard about this change in policy?
I mean, there's been a lot of conversation the last couple of weeks around unintended consequences of this policy, and perhaps new data that's emerged that suggested that there's been issues with diversion with certain pharmacies. So
they know this. Like, I've I've talked to a lot of doctors at the RAP Center. This is the RAP Center at St. Paul's. He runs it.
I don't think it's a complete surprise. However, it is quite a 180. It's quite a rapid change in the provincial policy. And so as a physician, and a physician who works closely with a lot of other addiction doctors, it's certainly something that that takes us by surprise a little bit, and is something that does certainly affect our patients quite dramatically.
And what?
It affects him quite drastically, and it affects his job quite drastically. Trust me. I was at the RAP Center. The first time I went there would have been the summer of 2023. I went there with my son, and my doctor, who was undertaking cancer treatments, was off for a few months, and I had a locum, and the locum didn't want to prescribe me my pain medication, and they told me to go to this place, this RAP Center, and I went there, and crazy story was that, I told the lady at the front desk, then they got me to the secretary, told the secretary the same story, then I told the nurse the same story, and that story was basically this: I have my prescription, I take it effectively, it works, but my doctors got cancer, the locum's in charge, they're not going to give me my medication. Is there any way I can get a prescription here? They said to me, we don't prescribe oxycodone or hydromorphine, we only prescribe Suboxone. I'm like, what does that mean? Like, I thought you're here to help because I don't know where to get my medication. Well, you'll have to find a doctor. Well, I have a broken back and blah, blah, blah. And the doctor said, well, actually, you're here because you took all your drugs. And I said, pardon me? He goes, well, I've been told that you ate all your medication and that's why you're here and it's an emergency. And I laughed and I looked down and I opened up my bag and I pulled out my medication. I had like 2.5 weeks supply of my medication in front of her. And she's like, oh, I didn't know. And I said, well, I told 3 people before I talked to you. So how did you get this message? She gave me some bullshit lie. I ended up just leaving. Anyways, it's a mess.
The concerns that you have for your patients right now?
So, just for perspective, I think that's important that a public policy like this, that provincial policy, does continue to evaluate the data and look at what's happening, what the consequences and unintended consequences of a program might be, and update itself accordingly. So that's part of the expected process. As a prescriber, though, it is quite a rapid change, and that requirement for witness dosing for these medications, while understandable if there's concerns about widespread diversion, is enormously impactful on patients. The idea that you have to go to the pharmacy, 3 or 4 times per day, puts a very, very high barrier on accessing this kind of intervention. So for
these pharmacies are going to need like triple security to give out as much medication, because the doctors are going to continue to try to give out this drug. They're going to continue to try to give it out, and these pharmacies are going to be full. It's not going to work.
To have been benefiting from an intervention like this, it does, I think, concern us quite greatly as to, where do we go next with that specific population?
And I think there's also the question of, do we have the capacity in the system for all these people to be witnessed going forward?
Mm-hmm.
Absolutely not.
We know that this won't apply to people that were already part of the prescribed prescription program. But what about for new people coming in? Is there enough?
So the policy announcement is effective immediately for new. For potentially new prescriptions, but it will be rolled out to all prescriptions in the near future. And you're right.
So the reality is this is really specifically tailored for the people that are looking for a way out from their addictive state, homeless, drug-addicted people that are coming into these centers looking for a safe supply, getting free drugs. They're stopping it. This is good. So if you have a prescription and you have pain as a result of injuries or accidents or disabilities, the doctors aren't going to touch you. But yesterday when they announced all this shit, they didn't tell anyone. And people were just my phone was blowing up, everything was blowing up. It's insane. Anyways, this is Drew Coover. I hope you got some information, and God bless. And I'm sorry if anyone was confused yesterday. It was not my intention.